Hello, Professor, and anybody else who might be watching. My name is Reid Paquet, and this is my Week 4 Assignment 2 submission. This is the Multimedia-Innovative Business Solutions project. Please note that I have attached a Week 4 Assignment 2 script, which serves as a supplement to this PowerPoint, and they kind of go together. Thank you. Here we go. First, we have our introduction. The company I chose was GTX Corp. GTX Corp is a company that was founded in 2013 that started integrating GPS technology into wearable tracking devices. Initially, their customers were people with Alzheimer's and dementia, and this was for people who had to keep track of those who kind of have fallen ill to this sickness. The idea has, though, transformed into serving families who are trying to track children, other family members, or even, again, still people with Alzheimer's or dementia. Next, we have our products or service overview slide. GTX actually has both products and services. So their products are the Take-Along Tracker, GPS Smart Sole Inserts, GPS Invisibelts, and the Amber Alert Tag. Now, all of these are designed to be inconspicuous wearable items that anybody could have on their person without anybody else knowing. Additionally, they also serve online in the form of an online monitoring system. They also have phone tracking and locator apps that they typically will work with the wearable technology that they also have. In addition to all of that, they have integrate GPS devices into products that normal people wear every day. And the idea there is, again, to be inconspicuous, especially in the products that are designed for children. In the event of a kidnapping or something of the sort, typically kidnappers might actually throw away a phone, but they might not think to throw away a belt. Next, we have threats to an existing healthcare organization. Main threats related to the healthcare industry are those related to adult care homes or retirement homes. These are places that, in some instances, monitor and track adults with Alzheimer's or dementia. If this product were to become more popular, people with elderly parents who suffer from these diseases may be more inclined to keep them at home and monitor them, as opposed to relocating them into one of these retirement facilities. An example or three of these retirement facilities are Sun City Hilton in Buffalo, South Carolina. There are 8,000 residents at this facility and charge anywhere between $100,000 and $500,000 annually to live there. The next is Sun City Summerlin in Las Vegas. There are 8,000 residents at this one as well, and they charge between $100,000 and $800,000 annually to live there. And finally, we have Laguna Woods Village in Orange County. With over 12,000 residents, this is one of the largest retirement facilities in the country, and they charge between $100,000 and $900,000. Something to note that is with people who suffer from either Alzheimer's or dementia, there typically is a much higher cost associated with living in one of these residential homes because of the higher touch care and services that are going to need to be provided to keep those people comfortable. Which brings us to partnerships with existing healthcare organizations. Various healthcare organizations, such as retirement homes, could purchase GTX's technology and utilize it in order to keep track of their residents. This would allow facilities to offer the opportunity for families to keep tabs on their elderly parents or loved ones and allow for faster access of medical information in the event of an emergency. This would also allow for healthcare organizations such as hospitals or primary care facilities to keep better track of patient whereabouts as they are on their premises. Or in a really out there idea, there's the possibility of healthcare organizations such as hospitals possibly tracking their own employees at work when it comes to patient care, with the purpose of improving response times and flow within the hospital. Now, having all of that been said, there is a big opportunity here. If handled appropriately, this product presents a large opportunity for both GTX and any retirement facility to make a lot of money. GTX and these retirement homes, if they form a partnership, could mean a large increase in revenue, and also a higher touch service yields more happiness on part of the people who are purchasing the services at the various retirement care facilities. Now, having all of that been said, it is important to note that there are mental health groups out there that are opposed to the tracking of patients within any facility. Now, this can be remedied, the legality of the issue that is, by having either the patient, if they are in a sound state of mind, or their legal guardian consent to their being allowed to be tracked at any given moment. And finally, we will head over to our references slide. If you have any questions, feel free to shoot me an email or leave me a comment. I appreciate any and all feedback. Thank you, and have a great day.